everybody. This is Dr.Surindher. I'm the Director of AestheticsPlus Clinics. Welcome to our channel. So many a patient come to us seeking a change in profile or a profiloplasty. So the facial profile on the side view is actually determined by the position of the nose and as well as the chin. There are various planes which have been mentioned and described to give us a proper idea about the profiloplasty or the profile. And out of this, the most important one is the 0 degree meridian, which is basically a line which is perpendicular to the Frankfurt horizontal. So if you see in this patient, there is a definite deficiency of the chin when the line is being dropped, so that is the meridian. And also, if you can notice in the pictures, her mentalis muscle is quite prominent, which is actually causing the chin to be retracted and also retruded. Chin augmentation can be done by either a filler or autologous fat. Here you can see the autologous fat is being harvested, and it is harvested from either the lower abdomen or the flanks. And here we use micro cannulas, which are basically cannulas which are 1 millimeter or less. For facial fat grafting, we usually target or use micro cannulas to have a very fine fat which can be harvested, which can be used for facial augmentations to avoid lumps. So once the fat is harvested and it is decanted, as you can see here, we are now transferring the fat into the smaller syringes, which are basically the 1 ml syringes, which we'll be using to inject the fat. The fat is injected into the chin or to the face using blunt cannulas, and which is why there are fibrous attachments also which need to be released. And here you can see the cannula being moved into different planes and in different positions, where small aliquots of fat, which are basically 1.1 to 0.2 ml of fat, small droplets which are placed in different planes and in different areas. And it's also, as we saw in this patient, she has quite prominent folds or attachments to the chin, and the mentalis muscle is quite active. So with this, we are trying to place some fat within all the layers so as to enhance the effect. Another thing we can do is with the cannula, we can also divide some of these attachments and place the fat inside them to prevent the reattachment, which helps enhance the results of the fat grafting. So this can be done either with fillers and or fat, and here we use finer cannulas and also blunt cannulas to prevent any injury to the nerves, the mental nerve, or any other blood vessels within the surrounding area to prevent any bleeding or further complications. So this is how the chin augmentation using fat is done, and then the fat is molded into place so that we know that the fat is in the right position to enhance and give you a proper result.